Dr. Cruz, so you've been using dental monitoring for over a year now. Can you talk about what it is and how it's helped the patients?
Yeah, in simple terms, it's basically a tube or what we call a scan box, and it attaches to our patient's phone. And all they have to do is once a week, they use that device and they scan their teeth. Um, it makes all the difference in the world for us. So by doing that, we're able to monitor and track the progress of treatment. We're able to see if anything is loose or broken. Patients are able to communicate with us directly. And I don't use the term lightly, but it is really game-changing technology
Hmm.
because we're able to have better access to our patients, see how things are going, and conversely, the same is true for them, where they're able to see and get a hold of us.
Awesome. I know it's really been amazing. We've been talking about it all year and it just seems to get better and better.
Yeah, it's funny. I was asking myself the other day, could I live without this now? And there's no going back. There's
Wow.
just no turning back. And I've
Awesome.
even tried to talk to some of my colleagues about this, and they're sort of tepid in wanting to, dip their toes in the water and see
Yeah.
what it's like. And I'm just praising, how amazing this technology is. And so I think that all offices will come around to it. I'm grateful that we're early adopters to it because, yeah, once you see the benefits, not only for the patients, but for your staff and for the practice, it's just, there's no going back.
Hmm. How often do your patients use dental monitoring? How is it involved in their routine?
Yeah, bare minimum, they use it once a week, right? They have to do the scan. The scan is easy to do. We have our patients do their first scan in office when they start treatment with us. So it gives us the opportunity to give them tips and tricks on how to do a scan so that I'm able to see everything that I want to see. So that first scan in the office might take 5 or 10 minutes, but thereafter, we have patients that can do the scan in a minute or two. So the time crunch on doing this is really minimal, especially when you think about all of the advantages that you get from it. And so that's bare minimum, but we have a lot of patients that actually use the messaging feature. And so you're able to get a hold of me directly anytime. I have a feeling a lot of offices don't use it the way that I use it, and I tell every single one of our patients, if you have any questions or concerns, you can get a hold of me anytime. The way that the dental monitoring app works is I'm able to set it up directly on my cell phone.
Hmm.
And so we have patients that have questions or concerns, or parents for that matter. And so, sometimes it's 6, 7 o'clock in the evening, sometimes it's on the weekends. And I encourage all of our patients to use that. And they're shocked when they have me respond back, usually within a matter of minutes. So some of our patients will use it more than once a week just because they have some questions they want to communicate with me.
I mean, it really is amazing that you're able to respond yourself to these patients. It shows that you're really
Well,
dedicated to them.
it's funny you say that because we've had some patients that'll sort of test it like, Dr. Cruz, is this really you? They're
Yeah, they
expecting it
think
to
you're an
be
AI,
automated
right?
responses. And so I said, no, no, it's really me. And we've also had patients that just assumed that I would get to them the next day. And so we've had a few patients that 11 o'clock at night, midnight. And so for me, it's kind of funny, like, okay, I'm going to actually respond back to them and kind of shock them. And so they go, oh my gosh, I'm so sorry. I wanted to send this message to you before I went
Yeah,
to bed. I wasn't expecting an answer until the next day. And so I said, no, 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 no worries. But I kind of get a kick out of it to kind of surprise them, like, oh my
yeah, I
gosh,
think
look
that's
at the
great.
service that we're getting.
So, based on your experience after using it a year, how has it changed the number of in-office visits for patients?
It's a dramatic reduction. And we've done a pretty deep dive into this as a result of having it for a year now. And the national average is 15 to 18 appointments in order to complete orthodontic treatment on average. Don't quote me on that, but I think I'm pretty close to that. And a lot of dental monitoring offices, including ourselves, are now able to get that in the 10 to 12 appointment range.
Wow.
And so, I think that's about a third less in the number of appointments. But even more importantly than that, and we can talk about this more, is the quality of the results that we're getting. I've always sort of prided myself on doing a good job with regards to the results for our patients, but at the same time, I'm also conscientious of it, questioning whether or not this is the best that we can do. And so I think the greater point is not that there's a reduction in appointments, but there's a reduction in appointments, and the quality of the results that these patients are going to have is actually better because
Mm.
there aren't any issues that kind of get past me because I'm able to see exactly how the patient is doing every single week. And so it really is a win-win. It's a reduction in appointments, but it's also, much better results in my opinion.
It's really amazing that you get the reduction in appointments, but also higher quality because you just assume those two would not go together at all.
In fact, usually you assume that they're going to be opposite, right? Like,
Exactly.
okay, fewer appointments, we're going to cut corners. Let's try and do this as quickly as we can.
Hmm.
But it's not the case. And it's probably worth mentioning it, at least for a minute or so, as far as how I use the technology. Once again, this technology can be used in a number of different ways, and some offices may not use it the way that I do. But the weekend prior to patients coming into their appointment, I will very carefully review their scans and then come up with exactly what needs to be done at that appointment that's coming up in the next few days.
Hmm.
And so when the patient comes in, we have a very specific laid out plan for that appointment. And so every single appointment now is intentional. It's not, oh, let's just have you come in, we'll see how things are going, and we'll figure it out. And so because of that, all of these little details that I'm able to catch when reviewing the scans in kind of a quiet environment at home, I don't have distractions, makes all the difference in the world. So that's how we use that technology to make sure that we're getting the best results.
What are the most common positive comments you're hearing from patients using dental monitoring?
There are a couple of positives. Dental monitoring has a feature where you click a button on their app and you can see sort of a movie that's been spliced together of the movement of your teeth. So
Mm.
once you get 8 to 10 weeks into treatment, there's enough of these photos to be able to create these pretty cool movies. And so patients love that. Every week they're clicking the button to see what's been added to the movie, to see how their teeth are moving, and it is really slick and it's motivating, right? We're finding too, and this was sort of an unintended benefit, that our patients' hygiene is dramatically better. And I think it's for a couple of
That's
reasons.
interesting.
One is, they're playing the movie, they're looking at their own teeth. They might notice a little bit of plaque, especially for some of the teenagers. And so
Yeah.
they realize, oh, geez, I need to do a little bit better job of sort of brushing. And so it really is kind of fun for our patients to be able to use this in a way that they enjoy. At the same time, I get to use it on a more technical basis and use it for their benefit. So they've done a good job of making it enjoyable for the patient to use while at the same time giving me valuable data.
I can attest to that because I'm getting treatment right now from a great doctor on the East Coast, but he doesn't have dental monitoring. And I would love to see that movie, and I'm missing it. I can just see the front teeth, which is really what I care about, but there's all this movement happening, and I don't know what it is. It's just like, it would
Right,
be really
right,
motivating to
exactly.
see it. I
Yeah,
would
yeah.
wish
Now
I'm
that
going to
you know
convince
that
you.
it's available, you're like, I want that. I want to see how I'm doing.
Yeah. For patients that want orthodontic treatment, what are the main advantages of using a practice that has dental monitoring?
The big advantage is for patients that are busy professionals or student athletes that have to travel the nation. It's fabulous for every single patient, if I'm being honest. I know it sounds like I'm probably working for dental monitoring here, but it really is fabulous for every single patient, but specifically for patients that are on the go. And so it's very challenging for them to come into the office. I can still remotely see how their treatment is going. I can communicate with them. We can stretch appointments out instead of seeing patients every 6 weeks, which is what most orthodontic offices do. It's more like every 12 to 14 weeks. And like I said, not compromising the quality of the results. And so we've definitely noticed a pretty sizable increase in busy professionals coming and seeing us and explaining that they're constantly having to fly out of state. We even have some patients that live out of the country and they'll just come and make the trip to see us a couple times a year. So it's a really good fit for those type patients.
Do you have any specific examples how dental monitoring improved a patient's experience?
There are a couple that have happened within the last week or two. We just recently had spring break here for the kids, and so there was a family that was in Hawaii, and a baby tooth was lost. So in other words, it became loose and was ready to fall out, but there was a brace on it that was still attached to the wire. So this poor little girl had a baby tooth that was kind of flopping around on the wire and couldn't get it off because of the way that the brace was connected to the wire.
Yeah.
And so I was able to send them a photo with diagrams on how to open the door of the brace, and then that basically set the baby tooth free. And so we
Wow.
communicated back and forth for about 5 or 10 minutes, and then we got the positive message for them. We did it. We got it off. Thank you so much, because it probably would have had a negative impact on their trip to Hawaii
I
had
bet.
this, yeah. And so that was definitely satisfying. Of okay, good. This technology is helping patients in a situation where they're 1,000 miles, 2,000 miles away. And then another one, which was on a more serious note, we had a patient, and the technology, the software is able to detect ulcerations or sores. And this patient had what's called a fistula. And so the patient basically had a pretty serious infection associated with a tooth that needed immediate attention and needed a root
Wow.
canal. But the
Yeah.
patient had no idea the nerve inside the tooth was dead, so she couldn't feel any pain. And so I was able to let her know, hey, so and so, I'm noticing this. Can you please go see your dentist? And sure enough, she needed a root canal. And so it felt good to be the one to catch that, even though that's not necessarily my wheelhouse. That's not what I do. It was fabulous to be able to keep an eye on the patient and help them with their general dental health.
I mean, this really makes me think how this is the future of health. Like, if it wasn't, we could take this beyond to like our skin, whatever, everything. If it could be monitored in more real time, like how much would healthcare improve in general? It's amazing.
That's exactly right. And I know, I think all of us have mixed feelings about AI. Some of it scares me a bit, but when
Yeah.
it comes to being able to review radiographs or photos, this artificial intelligence is in many ways better than the human eye. And so when you can apply that to these images, now you have, this amazing technology that's able to detect things that humans might not be able to pick up.
What potential challenges should patients be aware of when using dental monitoring?
The- there are a couple. I laugh because I sort of tease our patients when they start dental monitoring now. I get it. A lot of our patients are extremely busy, but what I say is that I need you to do the scans every single week. And so for
Yeah.
some of our teenage patients, they'll get a little bit lazy on me. And so it only takes a minute or two to do the scans. And so without doing the scans, obviously I can't keep track of how our patients are doing. And so we'll send sort of polite, loving messages encouraging them, so and so, I really need you to do your scan. And I'm not sure if you'd really qualify this as a challenge. It's really not that hard to do. The scans are easy, and it's only once a week. So there's that. And then the other second thing is that oftentimes our patients will love to use the messaging to be able to communicate with me. But I've started to realize over the last few months that when I try and communicate with our patients, sometimes they don't have the app on their home screen, so they don't see the notification.
Ah.
So now we've learned, okay, just to let you know, this communication goes two ways, because if I see something that requires me to communicate with you, I need you to check your messages. And so, these aren't big challenges, they're all very solvable. But by doing those things, it definitely helps with, improving the quality of their treatment.
Now, I'm sure once they see the benefit of being in communication with you as easily as it is, they'll be more likely to use the app.
Right. It's funny. So what we do now is when we install the app on their phone, we actually make our patients put it on their home screen, because we all have hundreds and hundreds of apps, and so
Yes,
oftentimes it's tucked away, far
that's
away, and
smart.
nobody. Yeah, it's so hard. So we actually make them put it on the front screen so that when they get that notification, it's easy for them to see now. And we didn't do that for the first 6 months, and that's been a huge improvement.
Yeah, that's a great tip for like every practice using dental monitoring right now because I wouldn't have thought to do that.
Right.
So, in general, how does dental monitoring help ensure patients are staying on track with their treatment?
There's a big one that we haven't talked about yet, and that is that dental monitoring has different goals that you can sort of customize. And so, whether it's um, being notified when a patient's bite on their back teeth is correct. And so we have a lot of patients that are wearing elastics, for example. And so you can basically check a box that says, I want to be notified when this patient's bite is ideal, is where it's supposed to be, or I want to be notified when their underbite is resolved. There's probably 10 to 15 different goals that you can select depending on what you're trying to achieve for the patient. And that has helped tremendously. With the way that orthodontics used to work, you never really knew when to bring the patient back. And so it'd always be a bit of a guess. Does the patient come back in 5 weeks, in 10 weeks? We
Mm.
really don't know. And when you use these goals now, you can be very specific as to when it's appropriate for patients to come back to their next appointment. It doesn't make sense for patients to come back until specific goals are achieved. This probably isn't the best analogy, but I was trying to think of something the other day. It's almost like driving a car that the fuel gauge isn't working. And so you don't know how much gas is left in the car. And so it's like, well, do I go to a gas station now and put more gas in? And so,
I've had
it,
that actually happen in an old truck that my dad had.
ah,
You had to basically guess and just make sure every 20 miles you just filled it up.
right, exactly. So you're thinking, man, I'm getting gas way more than I'm supposed to, but at least I'm
Hmm.
playing it safe. And I think that that's exactly what a lot of
Yes.
orthodontic offices did, was play it safe. And so this is why a lot of patients end up having more appointments than they really need to have. And so by using these goals and getting the notification, it's made all the difference in the world. Everybody's teeth move at different rates. And that's something that maybe a lot of patients don't understand. Some patients' teeth move incredibly quickly. I mean, as a general rule of thumb, younger children's teeth will move quite rapidly. And then adult patients' teeth tend to be a bit more stubborn.
Yeah.
And so you cannot apply how far out you schedule appointments uniformly to everybody because everybody's different. So by using these goals, you truly get custom treatment.
So, based off the experience you've had, what would you do to help patients? What would you say to them to make sure they get the most out of dental monitoring?
Yeah, it's simple. Do your scan, right? And so as long as you do the scan once a week, you're going to be able to maximize all of the benefits because all of the work is sort of on our end as far as being able to review the scans and figure out exactly what needs to be done. I just need to see the scans. And so I think some of our patients were really concerned in the beginning. They do the initial scan, they go, "Oh my gosh, I have to do this every day." And we say, "No, no, no, it's just once a week. It's not that bad." The other beauty is that you can dictate exactly what day a patient would like to do a scan. And so oftentimes with students, they're busy throughout the week. And so we can set it so that they do their scans on a Saturday or a Sunday. You can even set it to specific times of the day if that's more convenient. And so that helps tremendously because, everybody's so busy that you want to make sure that you set it up in a way that sets them up for success.
What about patients that are worried about fitting it into their busy schedules? How does dental monitoring help with that?
It's just a minute or two. And so when you compare it to the alternative is that you're going to need to come into the office. You're going to have to get in the car, drive to the office. You're going to need to be seen, and then you got to drive back to wherever you were. And so I get it. Sometimes doing the scans, like, oh gosh, I've got to do my scan. It's only a minute or two. But when you compare that to an hour or two that can be lost as in considering going into the office, when you factor in the drive time, it's such a massive time saver. And it's not rocket science. A lot of our patients pick this up right from the get-go, and we get a lot of those compliments when we see them back for their first in-person appointment where they think, oh my gosh, this is so fabulous. They're still able to make all of their sports practices. They don't have to miss extracurricular activities for school. Our busy professionals don't have to mess up their busy schedules. And so, when you compare it to the way that it's currently done, it's a big time saver.
What surprised you most about how dental monitoring has improved patient care over the last year that you've been using it?
The biggest surprise is that I don't have any more surprises. And so I guess I should explain that. So
Hmm.
by being able to see scans every single week, when a patient comes into the office, I know exactly what I'm dealing with. And it's probably worth talking about that for a second because The way that it works currently in other orthodontic offices is that a patient comes in, you haven't seen them for a month or two, and you really don't know what you're going to see. Has the bite been corrected? Does the patient have anything that's loose or broken? Have they been brushing their teeth well? All of these things are unknowns until they actually sit in the chair and you get to look and see what's going on. With dental monitoring, I don't have any surprises. I've reviewed their scan prior to them coming into the office, and I know exactly what we're working with. This has helped me tremendously. I mean, this is one of the things that I get so excited about. I'm not sure how excited patients get about it, but for me as an orthodontist, this is what I get really excited about, because I'm able to then make decisions ahead of time as to what's in the patient's best interest, as opposed to, I mean, for lack of a better term, winging it, right? You're trying to make decisions real time, at least the way that the thing that orthodontics used to be done. And so that's now out of the equation. You get time to really deliberately think about what you want to do for the patient because you know what you're dealing with. No more surprises.
Well, Dr. Cruz, a year in, it sounds like it's working great. Looking forward to talking to you again. I'll see you on the next podcast.
Yeah, take care.